It's a good day for the beach. Mark, Brian here. We're going to teach you something. What are we learning today?
We're going to talk about breathing. Brian comes in every morning and says, you need to be breathing. And so I think we all know that. But what a lot of people don't know is a lot of people have dysfunctional breathing. And dysfunctional breathing can cause problems with spinal support, with motor patterns, with pain in the body, such as shoulder pain, neck pain, incontinence, pelvic pain. So breathing is very important, and what we want to go over today is a couple quick ways how to assess your breathing to give you an idea if you might be having a dysfunctional breathing pattern or not. And so because of these things and because of its importance, we're going to address that this talk. So the first thing that we're going to address is what's called chest breathing. Because a lot of people, without even realizing it, breathe into their chest, top of their chest, not down into their diaphragm where they should be. And because of this, neck muscles in the front can get over tightened. The muscles on the side of the neck that attach to the ribs can get overworked. So this can be
headaches and be very detrimental to your day.
So they can cause poor posture problems, overdeveloped muscles in the front, pain in the neck, and you're not using your lungs to their full capacity. So a quick, easy test for this is you take and put a hand on your chest, put one on your lower abdomen, and just normal, easy breaths. Watch how you breathe. What moves first? If you see the first movement coming from your hand or more movement from the hand than coming from down here at your lower hand, you're probably a chest breather. You want to see more movement at the hand, down at your abdomen. So there's a pattern called paradoxical breathing. And that big word, all that means is a lot of people, when they breathe in, they suck their stomach in. That is incorrect because they don't want to look like their stomach's protruding. Normal, good breathing means that your abdomen comes out. It's like filling a balloon with air. So when you breathe all the way down into your abdomen. It should come out and come back in. So checking to see where are you breathing into your chest more or in your abdomen. That's test number one. A second test then that you can check. Now, let me go back on that one a second. You can test that too in standing and sitting. So getting in a couple different postures, needing to see if those postures change how you breathe. Because sometimes when you're making more demands on the body, you may change your breathing pattern also. So you didn't know that, did you?
That's interesting.
So I'm glad you showed up today. So the next one, functional residual capacity. All that means is how much air is left in the lungs after a breath. So a test for that is you take a normal breath in and just a normal breath out. Then you hold your breath, pinch your nose, and you see how long that you can hold that before muscles start moving because you're trying to get air in or you have to release your nose. So you would time that. So that's a test for the air that's left in your lungs. Now, a gauge for that to tell how you're doing is if you can't hold your breath in that position for less than 25 seconds, you may have a dysfunctional breathing pattern, okay? And ideally, a good breathing pattern for that would be if you can hold it greater than 35 seconds. Okay, so the next test is total lung capacity. This is how much air you can hold, and how we're going to test this. You're going to take a breath in, a breath out, and then take another breath in, a deep breath this time. Pinch your nose, see how long you can hold your breath. So this is for maximum time here. So even if your muscles start spasming or moving, trying to get air in, you don't stop the timer until you actually have to breathe again.
That one's a little harder.
Oh yeah. Woo! I thought you meant I stunk holding your nose, but. So, this one, you may have dysfunctional breathing if you can't hold it 35 seconds. A good breathing pattern and a good time would be greater than 60 seconds.
Wow.
So, I know it's a long time.
I would never be a good swimmer.
Well, my bride asked me how long I could hold my breath, and I said 30 seconds. She said that's not going to be long enough. So, anyway, so those are some quick tests to see how you're breathing. In the next videos, we're going to go over a few things you can do to help work on